Hi, it's Brandon from Step Forward Wellness. I want to talk to you a little bit about what pain is, what it isn't, and my approach to treating pain. So, there's this notion that pain is something that tells us that there's something wrong with our body. The first part is right. It tells us that something's wrong, and it's there to try to protect us. But it's not always giving us an accurate representation of the amount of threat that exists. Pain is complicated. Pain is not as simple as I hurt in one place and there's something wrong with that thing where I feel pain. Whether that's your elbow or your gut or your head or something like that. So, what I think is important to know is that our nervous system is constantly scanning our body unconsciously and also scanning the environment around us. It's then comparing the information from the body, from the environment, to our past experiences. And based on what our past experiences have been, we determine whether or not we're safe or in danger. When we've decided that we're in danger, remembering that this is all unconsciously happening all the time. When we are feeling like we're in danger, even if our consciousness does not think that we're in danger, we'll go into a little bit of fight or flight. This is our sympathetic nervous system. When we get into our fight or flight patterns, we get more anxious, we get more pain, sometimes we get hot. There's a lot of different things that can happen. Sometimes we have trouble digesting. There's a wide variety of things that can happen when you get more fight or flight. So what happens when pain is complicated is that fight or flight kicks in, and then our body goes into the unconscious patterns that we've developed over time to protect ourselves. What that means is anytime you've had an injury, any sort of trauma to yourself, whether it's emotional, physical, sexual, our body will go into the patterns that it learned to protect ourselves from further trauma. And what people will then have, once this is triggered, tight muscles, feels like my neck needs to crack, feels like my back needs to crack. The list goes on. Whatever it is that you experience when you feel pain, that will start to occur. And we get wrapped up in the muscles and the bones and things like that. And there's just a bigger picture as to what pain is. Pain is regulated within our central nervous system, and then our body responds as it responds to the stimulation of the perception of threat. So when the nervous system senses threat, we'll go into our fight or flight, as mentioned, and then the patterns start to emerge, as I was just describing, of how we protect ourselves. So that might mean the right side of my neck gets tight, the left side of my low back gets tight. Sometimes it'll even be where I can't move my foot as well, my knee gets kind of stuck. It can be a wide variety of things that tend to be unique to the individual experiencing them. So now what? Okay, great. I know that my nervous system is involved, but I still hurt. What do we do next? Well, that is what I'm going to show you over a series of videos. The very first step is always to calm the nervous system, to get us out of our fight or flight patterns, so that we can then start to form a new pattern. And it always involves, if the nervous system ramps up, we have to ramp it back down. Ramps up again, we have to ramp it back down. So that eventually, it's not ramping up so high. It's coming up just a little bit and back down. And our body knows how to get back to neutral. That takes time and effort, but is entirely possible. Once your nervous system is calm, what you're going to do is see a bunch of different exercises. But whichever one you're going for, you're going to move your body and determine, is one side seem easier than the other? Then you're going to do the easy side. And you're giving your brain a map of what's easy, what's loose, what's not as guarded. And then you'll just try the other side again. Once you try the other side, it might seem the same as before, it might seem looser. After a couple sets of doing easy side 10 times, you're going to start to find that it gets easier to the other side, whichever part of your body you're using. I'm obviously using my head and my neck right now. Once it's even, you do the easy side enough times, it starts to feel even. This is great. Now we don't have the muscular tension that we had before. We can move more easily. After you've gotten there, then it's time to learn to use your body again. Whether that means our posture, movement patterns, it's hard to say, everybody's unique, but what I'll present to you is how you can start to hold your body after you've started to decrease the neuromuscular tone. And then if we can apply that awareness and that movement that we'll learn to the rest of our life, whether it's sitting, standing, walking, running, playing a sport, once we make that new pattern, it becomes our new normal, and then our life gets a lot better, especially our pain. So if these videos are helpful for you, that's fantastic. Obviously, you will keep in mind that I didn't evaluate you, I don't know you, but I find that everything that you'll find here is safe. And if you're concerned that it's not safe, you should certainly consult your physician or your physical therapist or your chiropractor or whoever it might be that helps you with your physical health. My experience is that they're very safe and easy to do. Thank you for joining me, and I look forward to any messages about success or lack of success with the techniques that you'll find on this page.